Good morning and welcome to the joint CERS-KRS Retiree Health Plan Committee for February the 15th. At this time, I'd like to call the meeting to order and ask the Office of Legal Services for our opening statement.
Yes, sir. This is a regular meeting of the joint CERS and KRS Retiree Health Plan Committee. This meeting is being broadcast via video teleconference pursuant to KRS Section 61.826 and may be viewed by the public at the Kentucky Public Pensions Authority offices located at 1260 Louisville Road in Frankfort, Kentucky. It is also being broadcast to the public via Facebook. If you are speaking and are not appearing by video, please identify yourself before talking. In the event the video or audio broadcast is interrupted, we will attempt to reestablish a connection. If a connection cannot be reestablished within 30 minutes, the meeting will be adjourned and rescheduled to another date. Thank you.
Thank you, Mr. Board. Ms. Rankin, can we have a roll call?
Yes, sir. Mr. Powell,
Here.
Mr. Fulkerson,
Here.
Dr. Miller, and Mr. Piercy.
Here.
Thank
Three
you.
of the four are here, so we definitely have a quorum. I understand we have a public comment also, Ms. Rankin, if you'd be so kind to read that.
Yes, sir. This public comment came in from Mark Doran, and it reads as follows. The unfunded liabilities basically arose for many reasons. Whether it was not paying actuarial rates, planning for COLAs, or investment oversight, the system was not properly managed. The employees/retirees fulfilled their funding responsibilities. Attempts have now been made to address the unfunded liability, which is necessary. The problem is inflation is being ignored by both state legislature and our KPPA representatives, especially the CERS board. It's not realistic to expect retirees to maintain a stagnated 2011 level position benefit. The CERS board has been decreasing participating entity contributions recently instead of taking any approach to plan for a COLA. For the CERS contributing participant standpoint, I understand pensions are already expensive to fund. I also understand that people are the most important asset and deserve to be treated better than we have been. My former employer hasn't frozen the taxes I pay at 2011 levels. They can fund a retiree COLA instead of a pet project or two. Don't just read this and move on. We need you to speak to this topic and help now. I've been told KPPA and CERS don't feel as though it's their duty to actively promote any increase. It most definitely is. You are there to responsibly and fully represent your members. We have sacrificed, and it's time we receive some inflation relief. Please don't move on to the next order of business until you speak about this. Mark Doran. Thank you.
Okay, thank you. Next item on the agenda is the approval of committee minutes from October the 23rd. Has everybody had a chance to look at and review those minutes? And if so, is there any corrections, errors, deletions that we need to be made aware of?
Move to approve.
I have a motion to approve.
Second.
I have first and second. Any other discussion? All in favor say aye.
Aye.
Aye. Motion carries. Next will be a presentation by Humana. Ms. Garrison, would you go ahead, sir, please?
Certainly. Thanks everyone for having us be a part of your meeting today. I'm Tracy Garrison. I'm the account executive working with KPPA, and I have with me on the call today Larry Lowe, who is my supervisor, Carrie Lovell, who is our pharmacist, and Carla Whaley, I think she joined, who is VP of our team. And then also Penny Hahn, who is an actuary. We've asked her to join as there's a few topics related to CMS funding that we'll address later in the agenda. We can go to the next slide. So topics for today, we'll spend some time talking about the 2023 member satisfaction survey result. We'll also talk about the Net Promoter Score, which is another customer satisfaction survey that we take. And then I also have a few stats to share related to the call center statistics for 2023. And then from there, we'll do some additional Humana updates related to the Inflation Reduction Act, the CMS notices that are coming out. We'll touch briefly on the 2024 STARS outreach campaigns that will be happening for your retirees, and then give an update on the Baptist Health contract. We can go to the next slide. So the member satisfaction survey, this is performed by Humana annually. It is part of our agreement with KPPA. This is a one-time, like a look in time as far as what your member satisfaction is at that given time. We do contact your members and do an interview via the phone. This year for the survey, we had 502 members who we were able to contact and interview for the survey. So starting with an executive summary of the overview, plan usage, and satisfaction, the goal for this survey is for Humana to receive a 7 or higher on a scale of 1 to 10, with 10 being very satisfied and 1 being not satisfied at all. You'll see as we review some of the specific results that nearly 9 out of 10 of the participants were satisfied with the plan and were also likely to recommend Humana. These scores are consistent with the same high-level achievements we've seen in previous years. 88% of those surveyed in this year's satisfaction survey did indicate that they had utilized services in the previous 3 months. So we've asked them, as we do the survey, to specifically comment on their experience in the prior 3 months. And of those who participated who had used it during that 3-month period, 9 out of 10 members did report that they were satisfied with the claims processing, timeline, and accuracy of those claims. We can go to the next slide. This is where you can see, as I mentioned, of those 500 plus that we surveyed, 88% indicated that they had utilized the plan in that prior 3-month period. So we do see this as a significant increase from the prior several years. You can see 2020, it was 84%. Last year in 2022, we were actually at 81%. So we are seeing an increase in utilization of plan services in 2023 as compared to the prior years. Next slide. Looking specifically at member satisfaction, you can see the overall satisfaction with the plan administration. So those that were highly satisfied or satisfied for 2023, it's at 89%. And then likelihood to recommend is also showing 89%. So relatively consistent year-over-year comparisons as we see how the plan has performed.
Tracy,
Yes.
excuse me, can I ask you a question on the previous slide? The
Sure.
utilization slide, I'm sorry.
Yep.
So we know that utilization went down with COVID, and we don't have numbers prior to 2020. Is 88 more the norm, the pre-COVID norm? Is that about, are we getting back to normal is what I'm asking?
That's a great question. I can look back and see what some of, I've got all those old surveys. I can look back and see, and keep in mind too, that this 88% is reflective only of the participants of this survey. So 88% of the 500 that we've interviewed for this survey, we do feel that that's consistent with what we're seeing from plan utilization overall. But I'd be happy to follow up after the meeting and go back and look. We can look at like back in 2018 and 19 and kind of see from the survey participant standpoint what the utilization number is.
Great, thank you.
Sure. All right. Yep, I think that's where we were. So on this slide, you can see satisfaction with claims management, and this is what I was mentioning at the end of that overview slide, the executive summary. When we ask more specific questions of those people who have actually utilized services, we do see a high level of satisfaction with the processing of claims, the accuracy of that processing, and then also the timeliness of that. So all of those scores, 94 to 95%, and consistent with the prior year scores. Next slide. So additionally, as we look at people who are utilizing services, we ask in our questions, did you have reason to contact Humana via phone for support from a claims perspective, perhaps finding providers, maybe an issue with an authorization, anything like that. We continue to see a low incident of members needing to call customer service, with only 12% of those members surveyed indicating that they had a need to call Humana. But those who did call did express a high satisfaction with the resolution of their issue. Next slide. The customer care utilization, you can just see this here, is at 12% for those who needed to call Humana. And that is comparable to the prior year at 11%. So while we're seeing an increase in those in the survey who utilized services, we haven't seen a significant increase in those who needed to call Humana for support.
A question for you there, Ms. Garrison.
Yeah, sure.
Those are the ones that come into your call center. Are the ones that call into KPPA to the retiree health included in those figures?
No.
So
these are only people who have contacted Humana. Now, let me say this. That doesn't mean that those people, when they answer the question, they could be confusing the two. Like, we ask the question specifically related to Humana, but I suppose there could be somebody that would, combine the two or conflate the two together.
Okay.
Yeah.
Thank you.
Yes. All right. The next slide shows specific results as we ask questions about that customer service interaction. So disposition of the issue resolution. So once you call Humana, do you feel like your call was resolved, and how long did it take? So you can see 61% of those surveyed indicated that their issue was resolved on their first call. So there was no callback required. They didn't need to call Humana for additional follow-up. And then an additional 16% said that it was resolved after the first call, which would indicate perhaps Humana had additional work to do. Maybe we had to reprocess a claim, something along those lines. And then satisfaction with the overall resolution. We do see 59% highly satisfied and 18% satisfied. Also for a total of 77%, consistent with year-over-year performance. That was the data points I wanted to share with you related to this interview survey that we did. I will share through Connie the full report, so you'll be able to see all the additional commentary and additional data points that we reviewed, so you'll have access to that. But before I move on to talk a little bit about Net Promoter Score, are there any other questions about the survey itself? Okay, then we can move to the Net Promoter Score. So looking at Humana's Net Promoter Score, we do talk about this. We've been sharing this data for several years now. It can be a little bit confusing, so I always like to share kind of an update and a reminder of how the Net Promoter Score is calculated. But in addition to that point in time survey that we just reviewed, anytime that a participant calls Humana to ask questions about anything, we do give them an opportunity to participate in a survey. So immediately following their interaction with Humana. And this is the results that you see here. So the Net Promoter Score is a number from -100 to +100. And scores higher than 0 are typically considered to be good, and above 50 are considered to be excellent. So you can see for 2023, for KPPA specific members, the Net Promoter Score assigned from those surveys is 72.86% for KPPA, consistent with what we saw the prior year, and then and slightly over what we saw for 2021. So Humana continues to be very highly satisfied with these scores. We hope that you will share with that satisfaction as well. I think your members express positive results when they do contact Humana and interact with us. There's a small link you can see at the very bottom of that slide, Customer Guru / Net - Promoter Score. It's kind of a little video related to Net Promoter Score. I think it does a great job of explaining the industry explanation of Net Promoter Score. So we shared that this year in case you were interested in learning any more about that. Any questions, additional comments about the Net Promoter Score?
I would just add for the board, so KPPA requested in the RFP, and this goes back to the original RFP in 2013, that we conduct the traditional, so to speak, point in time member satisfaction survey. So that's what Tracy walked through. We have moved in recent years to this Net Promoter Score, as have others in the industry and other industries. We think this is a more contemporary and reliable measure of member satisfaction. And so that's why we continually talk about that. So this is a sort of a year-round survey. When members call in to ask questions, they're given the opportunity to take this one question survey about whether they would recommend where, as compared to that sort of one specific point in time when we reach a member through a traditional market research survey format. So just to give you some perspective on why we rely on this much more so than a traditional survey format.
I have a question, Larry. Does Medicare still require that you do that survey that was in the RFP? Is that still a Medicare function as well? Or requirement?
There are other surveys that are part of the STARS program.
Yeah.
You might hear the term CAPS and HOS.
Yes.
I don't know that I can tell you what those acronyms stand for, but they are also member satisfaction surveys that are conducted within the CMS star rating program.
Okay. Has CMS at all addressed Net Promoter Score? Or are they looking at, or I hadn't seen anything. I was just wondering if you had.
I haven't heard any reference to that. I'm not sure if any other Humana folks know anything about that, but not that I'm aware of, Connie, but we can ask.
No, that's okay. I just wanted to make sure, yeah, that I had. But yes, you're right. I like this. This is a good snap, especially, the business and financial component. Thank you.
On your question about CAPS and HOS, though, it's interesting. In recent years, the star rating system has moved toward member satisfaction and the member experience. So it has a greater weight in the star rating system, which we think is good for us because we think we know that our results on those surveys are good, traditionally have been good. So that has helped us to maintain our high star ratings.
Yeah, and we actually will likely have the STARS representative on the May agenda to give the 2023 results from the STARS scores and everything. So she would be able to, kind of focus in on a lot of that too as additional enhancement to this information.
That's great. Thanks.
Sure. All right, next slide. Okay, this is the 2023 call center statistic information. I think it's interesting this year. You may find it interesting as we look at the call volume year over year. So you can see the light green line is 2022, the darker green line is 2023. And in the third quarter, we see quite a spike in call volume. That does correspond to the Baptist Health contract issues that became known, I think, in that August-September timeframe. So we did see an increase in call volume there, and that has been consistent through the end of the year. So, we do know that there was a dramatic increase related to that. Looking at the call metrics, if you compare again to 2022, there we go, 2022 over 2023, you can see the increase in the overall calls, The ABA is the abandonment percentage. So those are the percent of folks who disconnect from a call into Humana before they have any interaction with a call representative. That's 0.18% for 2022 as compared to 0.53% 2023. And then the average speed to answer is 5 seconds 2022, went up a little bit to 13 seconds in 2023. The average hold time. So this average hold time is, those are seconds. So the amount of time they were on hold, not during the wait time to talk to someone, but once they've engaged with the representative, how much time are they waiting while the representative may be doing additional research? So
It's actually the handle time. That's actually the duration of the call, the average handle time.
sorry, yep, you're right. I was one too far. It was the hold time is the next one. Thanks, Larry. So you're right. So the actual handle time has gone down slightly year over year. And then also the hold time, as you can see, 202 over 117 prior year. And no busy signals. So any questions about call volume? All right. Moving on. Humana updates. We can go to the next slide. And for this, I'm going to turn the conversation over to Larry.
Thanks, Tracy. Good morning, everybody, again. I'm going to give you just a brief run through on a couple of pretty important topics as we look ahead to 2025. As Tracy said, we have Penny Hahn on the call today as well. She is the lead actuary and leads the group Medicare actuary and underwriting team. So her team is sort of intimately involved in sort of deciphering all the legislative impact, CMS funding, and whatnot, and that plays directly into the rates that we charge our customers. So Penny may jump in here as needed. But as we look ahead to 2025, we wanted to update you on a couple of important topics that will affect retiree benefits and the plan costs for 2025. On the first slide here, related to the Inflation Reduction Act, as you can see in that timeline, the Inflation Reduction Act makes pretty unprecedented changes to the Medicare Part D drug benefit, some of which began in 2023 and run through 2029. Most all of these changes improve the pharmacy benefit for Medicare beneficiaries enrolled in Part D drug plans, and that includes the plans offered by KPPA. Of greatest significance are the benefit changes that take effect on January 1st, 2025, so next January. And that includes the establishment of a $2,000 annual out-of-pocket cap on beneficiary spending on Part D covered drugs. These changes considerably increase the financial liability that both Humana as a Part D plan sponsor and KPPA as the sponsoring organization, so both entities will face pretty meaningful challenges regarding benefits and pricing for 2025, with the potential for significant increases in plan costs. So that is something that we are tracking very closely. There are a number of components to the IRA from an operational standpoint that have not yet been clarified by CMS. So we are still in sort of fact-finding mode on the IRA.
Larry, you might want to mention that for 2024, that catastrophic level is capped at $8,000, so they can kind of see the difference in the money.
Yeah.
$2,000.
And it is admittedly confusing because it says that it's a $2,000 maximum out of pocket starting next year. That is not simply a limit on the members' out of pocket costs. And Penny, maybe you can jump in here, but it includes other plan costs. But in either event, it is an improvement to the benefit for your members on both the premium plan and the essential plan.
Right. Yeah. So today the maximum out of pocket, as Connie mentioned, is $8,000. So you can see, most people today don't hit an $8,000 maximum out of pocket, at which time the plan pays 100%. But in the future, that $2,000 will be calculated differently and is significantly lower, obviously, than the current $8,000.
If you go to the next slide, and we come back to any questions you may have on both of these. On this slide, we give an overview of the CMS rate setting process. So as you may recall, CMS every year updates their Medicare Advantage payment rates, and they make any needed technical updates to the program to help keep those payments up to date and accurate. So they make those updates through the advance notice and the final rate notice, as you see on the screen there. CMS did publish the proposed 2025 advance notice on January 31st, and that included a series of routine updates, some improvements, and other recalibrations to MA payments that will begin in 2025. I would say the long and short of it is that the proposed growth rate that is in the advance notice is not sufficient to cover the current increase in medical cost trends that the whole Medicare Advantage marketplace is seeing, and it will create additional financial headwinds for us as we head into 2025. That would be on top of sort of the challenges that we talked about related to the IRA. There is an opportunity for CMS to incorporate the additional data from the fourth quarter of 2023 in the final rate notice, which will come out on April 1st. And so that could lead to changes to the proposed rates from the advance notice. So we just wanted to keep the board aware of both of these topics, and we'll keep you up to date, and you and your staff up to date over the coming months as more clarification comes out from CMS. Our goal is to be able to better pinpoint the financial impact on KPPA once we get the final rate notice this spring, and as we get closer to the rate renewal that we will provide, that we typically provide midsummer. So welcome any questions on either of those, the CMS rate setting process or the IRA.
All right. Thanks, Larry. Okay, just wanted to share with everyone, you can keep this for reference. Humana, obviously, throughout the course of the year, has numerous campaigns that we conduct educationally for your retirees based on information we have about claim status or just knowing what may need to occur for them. So you can see here we'll conduct are currently conducting the annual checkup campaign where we send notification to your members reminding them that they have the opportunity to receive their annual checkup at no additional cost to them and encourage them to do that. And then throughout the course of the year, we do information about risk of falling, the Nimble program, which honestly, as I'm sitting here looking at this, I'm not even 100% sure what that is related to. So shame on me for not researching that before presenting that to you. I'm happy to research that and follow up. There's also educational campaign throughout the course of the year related to osteoporosis post-fracture. So if someone's had a fracture, doing education for them, making sure that they're doing preventative work for that. Colorectal screening happens mid-year along with breast cancer notification. And then anyone who's eligible for a diabetic eye exam. If they haven't had that prior to May, we'll begin a campaign encouraging them to receive that. That continues into July with additional outreach for those who need to have kidney testing done and A1C. So all of these topics, as you're looking, we've got the colorectal, they do tie directly back to the Humana STAR scores that CMS reviews. So these are things that we focus on throughout the course of the year and do everything that we can to ensure that your members are getting the preventative care and screenings that they are entitled to as a member and really should be obtaining to ensure they are maintaining their best possible health. Any questions related to that? All right, starting in the May meeting, we will have additional details related to the 2023 STARS performance for KPPA. All right, next slide. This is the last slide and the last piece of information that we have. As of this morning, I did not have anything additional from a Baptist Health update. Larry or Carla, do you have any additional updates related to the contract?
I know that we are in ongoing discussions with Baptist. We do not have a new deal yet. I would tell you there's frequent and ongoing communication between Humana and Baptist with our goal to get a new deal done as soon as possible, but we're not there yet. I know that the access to Baptist remains in a good place. As we've said in prior meetings, I think we've did if there were ever any access to care issues, but I think that has quieted down substantially. So we'll keep this on the agenda. As soon as we have an update, we'll let you all know. But we're, as I said, we continue to remain in active discussions, negotiations with them, and are hopeful that a deal will get done very soon.
Mr. Lowe. Oh, go ahead, Carl.
Oh,
I'm sorry.
no, I was just going to say, I don't have any further update any more than what Larry just shared as well. So go ahead, Jerry.
Okay. I know that's not really in your purview, but I know that the Teachers Retirement System is having the same issues through I believe they have United Healthcare, and I assume they haven't had any luck in their negotiations either, or that you're aware of.
Yeah.
I haven't heard.
They had a new CFO come into play at Baptist, and I think that's what's causing a lot of, I think he is relooking at a lot of their contracts and has opened a lot of things back up. So
Yeah, guys, I just want to make sure that everyone was aware that KPPA is not the only one that's having this issue.
no, that's correct, Jerry.
All right, thank you.
Okay, any other questions? Anything we can do further research on for you all beyond what we already spoke about? Any other topics you'd like us to address? Okay, well, if there aren't any other questions, then that concludes the Humana presentation for today.
All right, Ms. Garrison, Mr. Lowe, everybody, Ms. White, thank you for being here and providing us with this great update. Thank you very much.
We appreciate the opportunity.
Sorry. Next up is the 2024 open enrollment statistics by Ms. Sutherland.
The next few slides are the final statistics for the 2024 open enrollment period. The first few charts will show a comparison of the 2024 and the 2023 open enrollment periods. The first chart shows the number of enrollments completed online and processed by our RHC counselors. The online enrollments decreased slightly for 2024, and there was a slight increase in the enrollments processed by our counselors. The Form 6256 is an annual requirement for hazardous duty retirees to verify their health insurance dependents are eligible to receive contributions. There was a small increase to the number of forms completed online, as well as an increase in forms processed by our counselors. If you'll go to the next slide. Thank you. There was an increase in phone calls for plan year 2024. The number of email communications and office visitors were comparable between the 2023 and 2024 open enrollment period. And there was an increase in virtual visitors for the 2024 open enrollment. Every year, KHP open enrollment email notification is sent at the beginning of the open enrollment period. There was an increase in members who opened and viewed the content of the email this year. And additionally, there was an increase in members who utilized the links enclosed in the email. Next slide, please. 5 KHP webinars were conducted. At the conclusion of the webinars, a recorded version of the webinar was placed on the KPPA website, and we had 240 views of the webinar. We attended 3 KHP benefit fairs, with the largest attendance being in Frankfurt. If you'll go to the next slide. We also attended various KPR meetings, and again, the largest participation was in Frankfurt. These numbers are increasing as we go post-COVID. We are attending more events, and more members are attending these events. Are there any questions?
Yeah, I've got a quick one. And I know this is, you don't have any statistics on this, but maybe from the input from the in-person meetings that you have with our constituents. I noticed that the online was a little off from previous years, and then the in-person or phone calls were a little higher. Do you think that was related to the ongoing issue with Baptist Health Group? I know you probably got a few questions at those meetings about that.
Connie?
Yes, we did.
Yeah.
Questions at those meetings. Tracy and I were at some of them, and I think some of the other staff, along with Brian at some of them, Brian Tolles, and there was a lot of questions around that. You're right. But we were able to talk to them one-on-one, took anybody that was having any questions or issues. Nobody had any trouble accessing care. There was just confusion either from the provider or for them, what kind of, Medicare Advantage Humana plan we had. So that made a big difference. Our education with the letter. And I still get little questions that, well, can I have a copy of that letter you sent me again? They're reaching out to us more, I think. That, and then, premiums went up a little on the KEEP plans, and because premiums went down so much on the Medicare plans, we got those calls too. So it's a combination of those things. Yeah.
Okay.
We saw.
Yeah, I just, because over the past several years, we've seen a more increase in everybody doing anything online, and this seemed more of an anomaly this year as the preceding years.
Also,
Yeah,
one reason it could have been less enrollments online is because in 2023, KHP removed a plan option, and those members had to move into another plan, and those are online.
That's true.
So it's about the difference of those plans is the difference in enrollments that we had from last year to this year.
All right. Very, very good. Thank you very much.
You're welcome.
Connie, Ms. Pajon or Ms. Sutherland, you have anything else?
No, I don't. Aaron, Rebecca, anyone? Abby?
I don't have anything. Thank you.
Thanks. No, I don't either. Thank you.
Okay, that completes our agenda unless somebody has something they wish to share. Hearing none, then we'll go ahead and adjourn this meeting for the Joint Retiree Health Plan Committee. I thank everyone for being here and for the work they did in preparing for this, and it goes on every day with Humana and KPPA. So thank you all very much.
You're welcome.